Hey everybody, it's Wednesday Night Live. I'm Dr. Duncan, and this is Ron Veitel.
Hello, everyone.
And we're at Siskiyou Biomedicine here in Medford, Oregon. It's been a while since I've been on Wednesday Night Live. So
It's been about a month, I think.
Geez.
I know.
Yeah. And now I'm leaving to Ecuador in 2 weeks, or in a few days, for 2 weeks. So a lot of you may know that already. If you got any tips or tricks for me, please let me know what you got. And if you've been to Ecuador before, I'd love to hear about your experience. It's going to be cool.
It's going to be exciting.
Exactly. It's going to be super exciting.
Yeah.
So what's our topic for tonight?
Topic for tonight is salivary hormone testing and why that's so important. And not only why is it so important, but why salivary hormone testing over serum testing?
Well, why would we want to test for hormones in the first place?
That's a really great question. I mean, they are the fountain of youth, aren't they?
I think they are.
I think hormones are the fountain of youth. They can be.
Sometimes.
Yeah.
Sometimes they can turn you around. So I recommend salivary or hormone testing in general for people that may not be feeling quite themselves, maybe feeling sluggish, rundown, brain fog, have a hard time healing, have a hard time getting out of bed in the morning, find that they're kind of drained all day but get wired at night, cold intolerance, constipation, diarrhea. I mean, there's a whole list of things. And when you're treating foundationally, it's nice to figure out what's going on with the endocrine system, what's going on with ovaries, testes, thyroid, adrenal glands, and what's the best way to assess all those hormones.
Yeah, it's crucial. I find that even just subtle shifts in people's hormone levels, if they're brought back into balance, make dramatic changes in their overall well-being.
Absolutely, and all you need is just a little bit sometimes.
That's right.
Yeah,
it's really nice to know where we're at.
Absolutely.
As far as the hormones are concerned.
Absolutely.
Is there any so why salivary hormones?
Well, so I would say salivary hormones for certain hormones. I wouldn't say the salivary hormones for all hormones, and the reason is that you can get a pretty good assessment of sex hormone binding globulin, testosterone nowadays, and thyroid hormones. Those can be pretty well accurately measured by serum.
Right.
But when it comes down to like estrogens, progesterone, testosterone, and especially adrenal function,
right, our cortisol levels.
It's saliva is pretty accurate, and more so than sometimes than serum, because there's no protein that's binding those hormones. So you get to see what the free levels are, what's available to the body.
Right, the freely available hormones.
Absolutely, absolutely. And in addition to all of that, it doesn't require a needle, right? So there's no trauma. It's saliva. It's saliva.
Yeah.
So while I use serum testing for some things, I prefer to use saliva for others.
Yeah.
How about yourself? What do you think?
I'm with you on that. I think I first got turned on to salivary hormone testing through doing adrenal stress index measurements. So seeing how somebody's adrenal functions were going. And I found salivary cortisol testing to be incredibly accurate in comparison to, say, a morning cortisol test via the blood.
Yeah.
Because with the salivary, what we could do is we can look at the cortisol rhythm. So rather than just seeing where it is in the morning, we could actually have the patient collect their saliva 4 times throughout the day,
Right.
and we could get a read of the rhythm of the cortisol, which is really important because it is a rhythmical hormone. So somebody could have, say, normal cortisol levels in the morning in the blood, but they might have a rhythm disruption where in the afternoon when it's supposed to be going down, it starts to go up.
You know, this really brings me to an important thought, and the point is that I had a patient recently, normal cortisol in the morning. So waking cortisol was appropriate, right? It was high in the morning, and the cortisol pattern is high in the morning, and then it kind of decreases throughout the day, and then tapers off in the evening, and you become tired and ready for bed. Her levels in the morning were normal, but the afternoon cratered, so went really way down to midnight levels, and then at midnight began to rise again. So the pattern was, it felt okay in the morning relatively, after lunch, I feel miserable. I'm so tired. I could take a nap. I want to fall asleep at my desk at work. And then get home from work, struggle through dinner, and then all of a sudden I'm awake.
Right.
And I can't sleep.
Right.
And my mind just races all night long, and I don't get any sleep, and I wake up, and I do the whole thing again. So while serum is useful as a screening tool sometimes for cortisol, AM cortisol, it's not giving you the rhythm like you've talked about, but it's also a snapshot. So even with sex hormones, even with testosterone, it's giving you what was happening at 10:03 or 8:05 when you tested. It doesn't say anything about what's going on at noon or 2 in the afternoon or 7 p.m. or bedtime. So I like the cortisol in that. I like the saliva in that you can look over a period of time.
Right. And in addition to being able to see the rhythm of the cortisol, which that's just such, boy, it's like getting the big picture.
Absolutely.
It's like getting the big picture, and I can see what's really happening, and it allows me to craft my protocol accordingly for that individual. So if we have somebody, like you're saying, has normal morning cortisol, but then it crashes in the afternoon, and then it spikes again, or it starts to go up again at midnight, well, then we know exactly what to use to bring the cortisol up in the afternoon and down in the evening.
There's no more guesswork.
Right.
We can really dial in the treatment.
Exactly.
And then we can easily retest when it's appropriate.
Right. And in my experience with adrenal testing, the second test is actually the most important test. Just to throw that out there, because we can actually see how is the treatment working.
Absolutely.
So doing that first test to get a measurement and see where somebody's at, and then put them on a protocol for, say, 3 months, and then do a retest. And now we can say, oh, we can see the successes, or where we can even dial it in a little more.
Absolutely.
Yeah.
And in today's modern society and all the stressors that we have, I think it'd be useful for all of us to really get a baseline of what's our adrenal status look like, because that could change a lot of things. The amount of inflammation in your body, how well you deal with blood sugars or dietary sugars, how well you're dealing with stress, what's the reason for your weight gain, why are you not sleeping? Those sorts of questions can be answered by doing a simple cortisol test, which is saliva. So it's not painful. It takes a little bit of time, but it's super awesome and accurate.
It's a test that, for me, in my practice in the past, that has provided me with so much information. It's probably the most valuable test I've ever run with most of my people. So because of the amount of stress that you were just talking about, and I was just teaching a class on stress yesterday, and discussing all the ramifications that long-term elevated cortisol has, or unmanaged stress has, in our physiology. And if our cortisol is elevated over a long term, or eventually the adrenals fatigue, and then we get lowered levels of cortisol, that is literally a spider web, ripples out throughout your entire physiology. There's not a system in our body that is immune to the effects of long-term elevated cortisol
or dysfunctional cortisol levels,
right?
Whether
like
they're super elevated or super bottomed out,
right? Or a rhythm disruption, where it's like you were talking to,
right.
Where it's neither chronically high or flatline, but just the whole rhythm is off.
Absolutely. Yeah, it can be completely reversed in people, right?
Exactly.
So you can't go to sleep, you feel really tired during the day, and it's just not useful. So getting that salivary hormone testing can be crucial. It could be life-changing, and we've seen that here in the practice. We've seen people, where we put just small inputs at the right time of day, with the right ingredients and the right medications or supplements, and it can really change and turn things around. So what are some of the things that you've seen with cortisol dysfunction? What are some of the physiological changes that you're talking about?
Wow. So in my experience, when you look at cortisol disruptions or long-term elevated cortisol, one of the first things that you can begin to see is blood sugar dysregulation issues, where perhaps you start to get insulin resistance.
Prediabetes.
You get the spare tire syndrome, so the weight gain around the midsection.
Yeah.
I've also seen where what will happen is when there's long-term elevated cortisol, there's a reduction in an immunoglobulin called SIGA, or secretory immunoglobulin A, which the adrenal stress test that we use actually measures SIGA levels. And if that's low, that's an immunoglobulin in the gut. And if that's low, what that does is it leaves the gut more open to infection and potential leaky gut. And that also will create a physiological stress response in the body that triggers the release of cortisol. So now you have this vicious cycle that gets started. Right. Another big one that I see a lot of is leptin resistance, which leptin is a hormone that lets us know that it's like our satiety hormone. So when we eat, our fat cells release leptin, and it lets us know that we're full and we're not hungry anymore. So if you have leptin resistance, guess what happens? You never feel full and satisfied. So you're constantly hungry, even though you're physically full. You're constantly hungry. So those are some of the big things. But I could keep going.
And I know there's a lot. There's a lot.
Thyroid hormone under conversion.
Yeah. Right. So you're not converting from T4 to T3, so you become hypothyroid.
Yeah.
Brain fog, headaches, insomnia. The list kind of goes on and on and on.
Yeah. Bone demineralization.
Right.
That's another one.
Right.
So really, I mean, taking what I said last night in my classes, it's easy for somebody to say, "Oh, everyone's stressed, just deal with it." But the reality is that or just kind of suck it up, just go about your business because everyone's stressed. But stress is such a major issue. It is the silent killer. So take it seriously. And I highly recommend almost anybody get an adrenal stress test.
It should be a foundational test.
Absolutely,
right?
yes.
If you're a part of Siskiyou Vitamin Medicine, ask for your adrenal stress index test. Let's get a baseline on you guys, and make sure everything is right where it should be. Foundational, right? So hormones are sort of setting the stage for all the biochemical reactions in the body to happen in normal physiological conditions. So if we can get hormones balanced, if we can get the adrenals balanced, we can figure out what's going on and fix patch up the holes or fix the problem, then everything else that you're looking for in terms of achieving your health goals become much easier.
That's right.
So your body's not struggling through it. It actually has the tools and the inputs it needs to make a difference in your life.
That's right. That's right. And you see a lot of hormone disruptions too.
Absolutely.
Right.
Right.
So, which coming back to the cortisol is that progesterone is the raw material for cortisol. So when we look at people who've got chronic long-term elevated cortisol, what might begin to happen is that they start to get decreased progesterone levels. And
then in women, you get estrogen dominance. And
right.
Males, you get dysfunctional testosterone receptor.
That's right.
Activation.
Because progesterone converts to androstenedione, which converts to testosterone, right? But cortisol will block that from happening, and you start to get low DHEA levels, so all your sex hormones get disrupted, low sex drive, low energy, less pleasure in life.
Jeez,
I know.
Depressing.
It's, but there's always hope because you can get it tested, and then you can get on a very specific, a personalized program.
Exactly. Exactly. And some people think that once they go on some sort of endocrine therapy, whether it be thyroid therapy or adrenals or sex hormones, that they have to stay on them forever. And sometimes that's just not the case.
Right.
Sometimes you can revive the body and bring back some vitality, and the body is like, oh yeah, I remember how to do this. But oftentimes, in addition to doing the testing, fixing the deficiencies, removing obstacles to cure is very important. So it's not just that we're going to test your hormones, fix the hormone, dysfunction. We're not going to send you back out to this dysfunctional, lifestyle patterns or eating patterns or mental patterns, emotional patterns. We need to work on all of those things so that we don't end up right back in the same place you were before. So we like to keep an open mind and do a comprehensive analysis and do a comprehensive plan so that we're addressing all of those things in your life to get you back to the place you want to be.
That's right. Stress management techniques,
Yes.
diet's crucial, avoiding things like caffeine or sugar or
Excess caffeine.
excess
sugar.
caffeine and sugar.
Little coffee's okay, right?
Well, you know, it depends on
It's
how far
debatable.
gone
debatable.
the adrenals are.
It's true. It's true. It's true. If your adrenals are zapped, caffeine's probably not your friend.
Yeah, they're not going to heal.
No, but coffee does taste good.
Right. But you know, some aerobic exercise or
Yes.
some gentle weight training, lifestyle modifications, you know, just getting some basic foundational lifestyle factors in place that can
Absolutely.
really help with healing. So
Easy peasy.
that's right. That's
Easy
right.
peasy. Well, good.
There we go.
There we go. Anything else about salivary?
I think I'm happy with that.
I do too. You know, I got to say one thing. Sometimes insurance will cover salivary hormone testing, and sometimes it won't. But if it won't, you guys will get Siskiyou Vitamedicine's price.
That's right.
So you know we can make it affordable for you guys. But if you're interested, talk to Ron or I, and we can get you set up for some salivary hormone testing and get a baseline on you guys.
Yep.
All right.
Way to go.
Excellent. If you have any questions, post here on our Facebook page, or shoot us an email, or give us a call.
Excellent.
All right, guys.
See you next week, next
See you-
Wednesday.
Oh,
But you won't be here.
I'll be gone.
You'll be gone the
Adios.
next 2 Wednesdays,
Yes.
at least.
Yes, I'll see you guys when I get back. Gonna shave off my adventure beard, so I'm back to the old normal.
You're not going to keep it for October?
There's October beard.
October.
Oh, October beard. I thought, yeah, I've never heard of that.
Yeah, November, December.
Well, at least part of October I have it.
Yeah, okay. There we go.
All right, guys.
All right.
Have
See
a
you,
great
everyone.
night. Talk to you later. Bye.
You got it? Perfect.
Sweet.
15 minutes.